Welcome to Aging in Place Strategies and Answers with Linda Prio. Will it be possible to remain in my home as I age? Do I feel safe in my home? How do I figure out how much support I will need when my health needs start to change? What if I decide to move into a community instead? Which community will meet my needs now and in the future? Who will play a role in helping me with decision making? Do you ask yourself these same questions? Aging in Place Strategies and Answers can help you gain practical knowledge that will help you create your own Aging in Place roadmap. If you are already a care partner, a power of attorney, or in crisis mode with your Aging in Place strategy, you will learn what you need to know that you don't know. For over 20 years, I have been marketing Aging in Place services to clients and educating families and healthcare professionals in how to put aging in place strategies into place. When you utilize aging in place, you are allowed to choose where you want to live and make those decisions so that you can retain your quality of life. Listeners, I want to welcome you back to Aging in Place Strategies and Answers. And for those that have been listening for the last few weeks, you know that my topic has been something that people just simply do not want to talk about. You don't talk about it probably between spouses. You may not talk about it to your family members, and you definitely probably are not going to mention it even maybe to your best friend. But that really can be a problem when we talk about the topic of urinary incontinence. And so a topic that we don't like to talk about, I'm bringing to the forefront because I am an advocate for you and for seniors, and I prefer to be proactive instead of reactive. And I know that's probably contrary to the way many people feel, but if I can help you and give you some information that will benefit your life, then I know that I have done my job and I have done it well. So I want you to know that my research has showed me that urinary incontinence is not a normal part of aging, but it can exist. And if you have been listening to my other podcasts, I want you to know that I have been talking about it. I did a general education podcast on urinary incontinence. I have had a section on women, how urinary incontinence pertains to women. In the future will be one that will an episode that will pertain to men. And now it is my privilege to have my guest, Brooke Kalisiak, with Legacy Therapy STL, so that she can help you and I, young and old, find lasting relief from pelvic health issues. And this is the other thing that I want you to remember as we're talking today is this. It is probably going to be without medications and more than likely without surgery. That's how she does her therapy. Now, the point is when we go to therapy or we address medical issues, we want to be able to stay active at any age without worrying about leakage or even pelvic pain. And Legacy Therapy STL is really able to help with those issues if you're experiencing that. But they also help people before pregnancy and after pregnancy and with menopause and the changes that it can sometimes bring, as well as those who have experienced abdominal surgeries. So Brooke comes to us today with a wealth of knowledge and experience, okay? But she certainly has the credentials to back up her practice. She has a doctorate of physical therapy and a master's of science in physical therapy from Washington University here in St. Louis. She is also a wife and a mother, and these are the activities she likes to do in her free time, which are definitely not sitting around. She likes hiking, mountain biking, reading and checking out local restaurants. So, Brooke, I would love for you to say hello to my guests. And I would love for our guests to hear what led you into this important benefit to your patients that you're working with in their pelvic health.
Yeah, wonderful. Thanks for having me today, Linda. I really do appreciate it. So, like Linda said, my name is Dr. Brooke Kalisiak, and I'm the owner of Legacy Physical Therapy here in St. Louis. And I have been a practicing physical therapist for, ooh, let's see now, 23 years. And I've owned a Legacy Physical Therapy for the last 17. And I really, I saw a hole in the St. Louis market back 17 years ago where there just weren't many people who were pelvic physical therapists. And there were some wonderful ones in town, but they were hidden inside of the big hospital systems, and
Okay.
people didn't really know that they existed. And so I opened Legacy Physical Therapy to basically be able to shout from the rooftops that these pelvic health issues like bladder leakage, like pelvic pain, pain with sex, pelvic organ prolapse, they exist. And there are conservative treatment options that can be done so people can avoid having to take medications or risky surgeries or that. And so that is kind of how why I ended up opening Legacy Physical Therapy, because at the time in St. Louis, there were no pelvic health exclusive physical therapy practices. And I wanted people to know that this expertise existed and that this was a safe place that they could come and get conservative treatment options for these conditions these conditions, unfortunately, a lot of people think it's just a normal part of aging and that they just
Right.
have to deal with it. And it's like, nope, there are things you can do. So that was kind of my mission behind it. And we've grown and expanded over the years. It's myself and four other pelvic physical therapists now. And we have two different locations here in the St. Louis area. So we're loving the fact that we're getting the word out there more and more about pelvic health issues and that there are things people can do about them.
And I'm so grateful for that. And Brooke and I met at a vendor fair, and she was at her table, and I had already started my thought process on uh, urinary incontinence and how it affected people, and especially men who are going through prostate issues. There's a lot of prostate cancer among men of varying ages. And sometimes those surgeries lead to other situations as well as treatments. And women who've had children also are in that same boat. And so my brain was spinning, and as it always does when I get on a topic. And then I just happened to look up, and I even said that to Brooke when I saw her. I'm like, I just looked up and saw your booth, and I made a beeline over there. And she said, Linda, I can send you information. So listeners, you've met Brooke now, and we're going to talk about how you can get a hold of her. But I did look at her website, and I'm going to tell you that even if you are in that mode where you don't want to make a big splash in the pond and say, I'm ready to address this in my own life, I can tell you with confidence that you can go to Brooke's site, and she has downloadables that will help you gain some information that will help you immediately. So I'm going to encourage our listeners to do that. We'll talk about that a little later, and I'll have your contact information in my show notes. But you said you have two clinics. You're really local to St. Louis, and we've already said it twice that urinary incontinence is not normal aging. Okay, so don't. I think if you were going to throw a thought out of your brain, is that you don't have to accept this, that this is not a part of normal aging, but you're probably going to experience it. What can people really do as they age and they experience some of these bladder issues?
Yeah. So our one of our catchphrases at our office is common, not normal, because a lot of
Okay.
pelvic health issues are common. So bladder leakage, 1 in 3 women in their lifetime will experience bladder leakage. So it is common, and it does get more common as we age. But like we just said, that doesn't mean it's a normal part of aging.
Okay.
I often say we are not all marching back down the path to diapers again. We don't
Thank
want to
you.
start life in diapers and end life in diapers. Like, no, we should be able to avoid that.
And I just want to stop there and say thank you for that, because I think as a senior, some of the things that you're most afraid of, and I'll just speak this from my own mind and maybe other people will agree, is that we worry that we're going to have dementia. And we worry that we're going to lose our dignity. And that's really what we're discussing here is our
Yeah,
dignity.
very much so. And I feel like over the last 5 to 10 years, we've seen a trend where it's become a little bit more socially normal to talk about or to see ads about
Yes.
incontinence and what things we can do for it and that. But unfortunately, most of that stuff is here's the latest and greatest pad, or here's
Yes.
your lacy Depends that you can wear. And it's like, okay, but what can we do so that I don't have to use those products? And so
Hmm.
that's where partnering with a pelvic physical therapist can really be helpful.
Now, a word from our sponsor.
Are you looking for resources on senior living? Check out guideforseniorliving.com for our free online senior resource guide to find senior housing, care, and community connections. Start searching now at guide 4 seniorliving.com. That's guideforseniorliving.com to find the contact information for senior housing, care, and community connections.
Now, let's return to the podcast.
Whenever I get on a talk, I always bring my pelvis
Oh,
with me.
good.
And
Okay,
then,
good.
so this is our bony pelvis, and if I tip it up, we get what I kind of refer to as a gynecologist view here.
Okay.
But anything that's in red here is muscle that's in the pelvic area, and all of this is collectively known as our pelvic floor muscles.
All right.
And it's known as that because if it's not there, we've got a big hole in the bottom of our pelvis. So the pelvic floor is effectively the bowl on the bottom of our pelvis that all of the pelvic organs kind of fit inside and
All
kind of
right.
it supports there. So these muscles, the pelvic floor muscles, are super important for many different functions. They're a small group of muscles, but they help to make sure that we don't leak urine or feces. They're involved in sexual function. They help to support the organs so they stay up and in where they're supposed to be.
Yes.
They help to support the pelvis as a whole and work together with our abdominal muscles and our diaphragm to manage pressure in our trunk. So the trouble is that with our pelvic floor muscles, a lot of times when people talk about them or when they think about them in isolation. So many women, maybe not as many guys, but many women have been told or heard, I should do Kegel exercises. And a Kegel exercise is a contraction of the pelvic floor muscles. And I'm not saying that we shouldn't have strong supportive pelvic floor muscles. We do want that. But hopefully, as what I just said, as all of their different functions, we don't want to think about those muscles just in isolation. We want
Correct.
to think about them as they work with our entire body and
Okay.
making sure that they work with our breath and our abdominals and our hips, and all of that has to work together. So if anyone is ever giving you, if you're talking about having a pelvic health issue like bladder leakage, and someone's telling you, oh, you just need to do hundreds of Kegels and that'll get it better, that's really poor advice. And
Okay.
because those muscles just don't work in isolation. They work with other things in the area. And prescribing an exercise or an activity without actually evaluating what's going on is very generic and oftentimes not very helpful. The example, I oftentimes go to orthopedic examples. It'd be like you going to a doctor and saying, you know what, my shoulder hurts. And the doctor kind of just looks at you and he's like, yeah, do some bicep curls. That'll
Yeah.
help the shoulder. And you're like, well, maybe it will, maybe it won't. Don't know. We don't know why my shoulder hurts. And so just to generically say I have a pelvic issue, okay, do Kegel exercises. It's a blanket kind of caveat. Here you go, try this. And for most people, it doesn't work.
Well, and I think one of the key things for me is remembering that it is a group of muscles. And we know that when we work those muscles, that we can regain strength.
Mhm.
So what your brain is muscle.
Yeah.
If you don't use it, you're going to lose it. And all of us know that phrase. So I want us to be thinking about that as Brooke has talked, because those of you who were just listening to us, you didn't get to see the big wealth of muscles that are actually in the floor and then coming up through the hips. And when you said that it's a bowl that holds these organs, then it's a big deal. So let's not ignore. We might do bicep curls every day, but this is a whole different set of muscles, and our physical therapists know the body, the anatomy, and how to help you to engage these muscles. So I appreciate you showing us that. So I hate to say this, but is it ever too late to try to improve my continence?
No, it's never too late. And that we get that question all the time. And it cracks me up because we get that question at all ages. But I had a woman who was only five years postpartum from having her kid. And she's like, is it too late for me? And it's like, no, it's not too late. And on the other end of the spectrum, our oldest patient was a 93-year-old woman who was having bladder leakage, and she was sick of it and wanted to get over it. And like she came in and worked with us and did her pelvic physical therapy and was able to get leak free. So no,
Oh, that's super
it's never
good.
too late to make changes on our musculoskeletal system and what we're doing. So
Yes, absolutely. Absolutely. Well, that alone is such a hopeful sentence
yeah.
to all of us. And it really opens that door to prove that yes, it can happen at any age. But there are things that can be done. So how does pelvic physical therapy help with bladder issues then?
Yes. No, great question. So, like showed you guys with the muscles here. So this literally only has the pelvic floor here, but if I tilt back up, we've got the abdominal wall is going to be right here, and at the very top is going to be our diaphragm up here. And on the back side, we're going to have our buttocks muscles and our back muscles. So that is what I like to call the core canister. Like if you think of our trunk area like a soda can, we've got our diaphragm at the top, the pelvic floor at the bottom, the abdominal muscles, and the back muscles. And
Okay.
all of that, we want a nice, supportive, upright canister that works
Yes.
well together. And so if any part of that can is not working well, it can affect other areas. And a common place where we have issues is the pelvic floor because gravity. When we're
Yes.
upright all day, the pelvic floor area tends to take the brunt force of it. And
Yes.
so as pelvic physical therapists, as physical therapists, we are experts in the musculoskeletal system and how we move and all that works together. Pelvic physical therapists have extra training in the pelvic area and how it relates to normal bowel, bladder, and sexual function. And so it's our job to evaluate what all these different muscles are doing together. And commonly, we might find if you're dealing with bladder leakage, that the pelvic floor muscles might be too weak or are uncoordinated and aren't kicking in at the right time. Some
Okay.
people, the muscles are there, but they're not getting turned on fast enough, or they're not turning on at the right time. Sometimes people think they're recruiting the pelvic floor muscles, and they're actually doing the exact opposite. They're kind of pushing out on them and straining
Okay.
outwards. And when we do a Kegel exercise or a contraction of the pelvic floor muscles, it really is kind of a lift up and in. Or like if you and I are both sitting right now, like when we're sitting, my sit bones should stay on the chair, and if I'm a female, I should feel kind of my vagina and anus sort of lift up off the chair a little bit. If I'm a male, I might feel my scrotum and my anus kind of lift up off the chair a little bit if I'm contracting these muscles correctly. Okay.
Yes.
But sometimes people think they're doing the pelvic floor, but they're really doing their big buttocks muscles. I see them
Yes. Yes. Lifting off
bouncing
the
in and
chair.
out of the chair. And it's like, well, those are your glutes, which we need to work too, but they're not quite the same muscles. Or people get in the habit of always holding their breath when they have to
Yes.
recruit it. And when we breath hold, remember that soda can analogy, that makes us like a closed soda can, which is very pressurized. And that pressure's got to go somewhere. And a lot of times it goes down. And that's why
Okay.
we can get that pressure out, that can lead to prolapse issues or leakage issues. So sometimes it's as simple as teaching people to breathe a little bit better and to not hold their breath with certain activities. And a lot of times people don't even have they're like, I had no idea I was doing that. It's like, yeah, it's a
Right.
habit that you've gotten into
Mm-hmm.
over the years. We don't, once we learn how to ride a bike, we don't think about it. We just ride a bike. And that happens with all sorts of movement habits. And some of them are good for us and some of them aren't.
And that's what the retraining does. I have done many, many talks for two people who are trying to regain their lifestyles after whatever happened, and I might be in an acute therapy setting. And when I ask the question, how many feel that the exercises that they're doing have had value and helped them to recover? 100% will raise their hand.
Mhm.
And then I say to them, how many of you feel that you would do these exercises on your own? And nobody raises their hand unless there's some weird anomaly like myself who actually prefers to exercise.
Mhm.
So that's just human nature and that's who we are. And and I loved what Brooke said about, Kegels, that's one thing.
Mhm.
But there's so much more to the picture,
Yeah.
and having that evaluation that is part of the treatment
Mhm.
so that you're getting the right exercises is
Mhm.
important. And if you didn't catch what Brooke said, she mentioned that you guys have extra training in the
Mhm.
pelvic floor, which is what your clinic is really founded upon,
Yeah.
and that there are physical therapists that do have this, but they might be in a location that you might not be able to get to them. So I want to kind of move into what Brooke and I were talking about before we started this conversation, and that is, how can people find
Yeah.
you in the St. Louis area? And then what I want to do, and then insurance, and then if you don't mind, for those that are not in the St. Louis area, could you help us get some talking points or some questions that we could ask our
Yeah.
preferred physical therapy clinic that we would reach out to, who may look at us like we have two heads when we're asking these specific questions. So help
Yeah.
us through this, Brooke. Help us
Yeah.
get
No.
get help when you're not available to us.
Yeah. No, all good. And so yes, if you're local to St. Louis, we'd love to help you at our facility. And online, you can get us at www.legacytherapystl.com. And like Linda said, we have lots of information on our website to meet you where you're at, whether you just
Yes.
want to download one of our guides about various pelvic health conditions and start reading on your own. We do a new blog post every week about a different pelvic health topic. I put out a YouTube video every week about a different health topic. So we meet you where you're at with, learning about pelvic health issues. And on socials, so Facebook, Instagram, and YouTube, it is Legacy Physical Therapy STL. So again, if you prefer to watch in video content, that you can
Yes.
find out that way about different pelvic health issues. But yeah, as far as at our facility, we typically start one of two ways with people because a lot of people, this conversation that Linda and I are having right now might be your first introduction to pelvic physical therapy. You may have never heard of that. I've been in business for 17 years, and every week we still have at least one or two evals where like, I had no idea this was an option. They come in and they didn't know anything about pelvic physical therapy. So although the profession's been around for a while, there's still a lot of people who have no idea that this is even an option out there for them. So
I was one of those people.
yeah,
And so
yeah.
this is why I asked Brooke if she could come and be with me, because literally, I
Mhm.
know I've been in this career field for 20 plus years, and it was just like a light was shining across the aisle from me. And I just couldn't believe what I was seeing. So, literally, don't feel bad if you
Yep.
are not in the know, because I was not either. But
Yep.
when I learn something, you're going to learn it, listeners. Go
I
ahead.
love it. I love it. No, that's great. And that's so for many people, we know they're going to be coming in with lots of questions about what might be involved, especially if they've gone to physical therapy somewhere else, like maybe they've had a knee replacement or an ankle injury, and they've gone to typical or orthopedic therapy where they're going like 3 times a week, and there's a bunch of people in the gym and they're all doing exercises together, and then they're like,
Yes.
but wait, I'm going to go talk to you about my bladder, and I'm going to talk about these very private issues. Pelvic physical therapy is very different. We have private treatment rooms. You're one-on-one with the therapist
Okay.
the
That's
whole
kind of
time.
nice.
That you're not in a big gym with lots of people. Now, that's at our facility. So I specifically designed it that way so that we knew we
Thank
were going to
you.
be talking about very private issues, and we wanted people to have a comfortable, safe place to come talk about that. So remind me to come back to that when I tell you what questions to ask.
All right. Okay.
So, um, but yeah, pelvic physical therapy is a little bit different than your normal kind of orthopedic physical therapy. So we at our facility, we start with something called a discovery visit for most people,
Okay.
which is a complimentary appointment that you can do over the phone, Zoom, or in person, where basically we just have a conversation. You get to learn a little bit more about legacy physical therapy and us and how we treat. We get to learn a little bit more about you and what's going on, and talk about what this might look like to help you reach your goals so that
Yes.
you can make an informed decision as to like, oh, this sounds like something I want to do, or, oh, I want to do this, but this isn't the time because, Christmas is coming up and I'm going to have all my family in, and I'm going to start this in the new year.
Right.
So
Right.
let you make an informed decision of what might be involved. And then the follow-up step to that, or the second step that many people, if they know like already, this is what I want to do, they schedule an evaluation appointment. And that's where we do talk more and get a deeper history of what's going on with you related to your symptoms and your any other medical issues and things that might be going on. But then we do a full evaluation of, well, I kind of break it up into two parts, the external part and the internal part. So the external part is we're looking at your posture, your breathing, what are your abs doing, your back, your hips, all that kind of stuff, and getting a sense of what all those muscles are doing. And then the internal part is, so if I bring back my pelvis, the gold standard for assessing the pelvic floor muscles is similar to a gynecological evaluation for women. So I would be inserting one gloved finger into the vaginal canal to assess what these muscles are doing, how well they're contracting and relaxing. Are they too tight? Are they too tense? Are there any scar tissue from maybe past episiotomies or tearing with childbirth, anything like that?
Mm-hmm.
Um, that's all explained in depth. That is all with multiple asks of permission. And yes, there
Yes.
are times where people are like, I don't feel comfortable with that. Like, I don't want to do that part. And that's okay. We meet you where you're at with it.
Okay.
Okay.
Good.
So I don't want that part to scare people off. That is
Yes.
the gold standard. But we've had many patients who come in saying, I'm not comfortable doing that at this appointment. And there's still things we can do. We can still help
Wonderful.
out. There are times where maybe we work together for a little while and then we're like, okay, I still think this would be important that we try and do that part of the evaluation. Are you more comfortable doing it now? And there's
Yes.
other times where it's like, you know what, we're accomplishing your goals without having to do that part. That's great. We don't have to go down that path.
All
So,
right.
we're very proactive, very consent minded. That's one of my pet peeves in the medical community of providers who are just like, well, this is what we do. And, it's like, no, ask consent and make sure the person, feels comfortable with it.
Well, and
So,
I very much am a patient centered, the patient's at the center.
yeah,
And what you're comfortable with and what you're not, and Brooke is taking every opportunity to educate you so that you have informed consent, and that is what we should expect in our
yeah,
our medical team. So
yeah. And I think
important.
that's one of the benefits of doing what we do and the setup that we have, being one-on-one with a patient for an hour. Like, we have the benefit of time and
Oh
being
my
able to
gosh.
talk with you and hear your whole story. And that in and of itself is super therapeutic, because a lot of times patients have never been able to tell their whole story. Like their gynecologist might be wonderful, but has 5 minutes with them and then that's it. And so thankfully their
Yes.
gynecologist maybe refers them on to us, and it's like, okay, we get to get the bigger picture, what's going on or that. So
And the privacy that you provide in
mhm.
this conversation and in
Yeah,
these evaluations is huge. So thank you for that. That dignity factor is so important.
yeah,
And it really allows a patient to open up so that you can treat them appropriately. You know, you
mhm.
really have to share. Your
Yeah,
doctor, your physical therapist is not a detective.
no, it's very
If
true.
you don't tell them, they do not know. So
Correct. And
yeah.
I'd say it's super common in all of our evaluations. Someone will almost always say, well, this is probably TMI, too much information for you. I was like, oh no, in pelvic physical therapy, there's never TMI. Like, fill us in. Like, tell me more. That, and I guarantee we've probably heard it before. And
Yes,
so, no,
yes.
please share.
And I think that's so true. And that just goes back to what you said in the beginning.
Mhm.
Common, not
Yeah,
normal.
correct. Correct.
Common, and then we see that in senior care too. We
Yeah.
see common,
Hmm.
not normal. We can do
Yeah.
better, right?
Yep.
How can we help you do better? So
And,
I agree with that. So insurance,
mhm. So insurance wise at our facility, so let me back up for a moment.
okay.
Pelvic physical therapy is a niche area of physical therapy as a whole. So if you
Yes.
are wanting to check your own insurance benefits, you just need to ask, what are my physical therapy benefits? There's
Okay.
not special pelvic physical therapy benefits. Okay.
Right.
So you ask about what your physical therapy benefits are. At our particular facility, we are in network with Medicare and TRICARE, and we are out of network with the private insurances. And that allows us to provide that one-on-one care in the private setting with people in that. So we have one of my pet peeves in the medical community is that there is not financial and transparency in medicine. And so that is the opposite at our practice. We have this discussion up front with the person on the phone so they know what their potential costs might be coming to see us so that they can make a very informed decision of, yes, I want to invest in my care this way. I know what costs might be involved, and I'm ready to make that commitment. And so, and then we have the ability to meet you kind of where you're at, depending on your particular situation. So everyone's individual, their plans are different depending on what their insurances are. But I am so over the fact of different. Well, I like just this past week, I had a person who came back to us. So we weren't in network with her insurance, and she's like, I really want to use my insurance. I was like, I completely understand. This was like a month or so ago that we had originally talked with her. She's like, I'm going to try and find somewhere in network. Like, great, we're going to follow up with you, make sure you get the care that you need and want. And
Yes.
she actually called us before we had a chance to call her. She's like, well, I did get in somewhere in network with my insurance. We're now a month out. I just got my first bill. And even though I was in network and it was covered, they didn't tell me that, I hadn't met my deductible, my $5,000 deductible yet. And it was a big hospital system. They're like, they charged me $500 a visit. And so it was covered, but because she had a deductible, she was responsible for $500 a visit.
Oh my
And she's like,
goodness.
yeah, I was like kind of floored. And so even when people say that with us that they want to try to find someplace in network, we give them an insurance verification check sheet and questions that they should ask the other facility to try and make sure, because covered and paid for are not the same. And
Yes.
so when you call up, a lot of times they'll say, oh, yeah, we take Blue Cross Blue Shield, it's covered. It's like,
Yeah.
yeah, but
Yep.
what about your plan?
Yes, 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 yes. And so that's people listen to what Brooke says. She knows she has to bill. So, that's the reality of it.
Yeah.
And because I've worked in senior health for so long, and I know that people operate under false impressions, just like you said, it's covered, you hear that, or it's in network, or no, my insurance doesn't cover this. And I just want to reiterate that not everything in life is free, but you have to put that up against what do I want? Do
Mhm.
I want subpar health and a subpar active lifestyle? Do I want to be concerned about this, or would paying the additional monies be worthwhile to me? And I can't evaluate that for you, but I know that that's a question that you really have to ask yourself and decide how
Yeah,
you want to live, and how you expect to live.
yeah,
And you're at the center of that picture, but there are people who can help you.
yeah. And a lot of times, especially as it relates to urinary incontinence, there's kind of a twofold with that. Like, it's like, okay, yeah, wait a minute. This surprised me. I didn't know that this was going to be something that I might have to pay for to get this type of care.
Yes,
But on the flip side of that, what is it costing you to buy enough pads to
correct.
cover? And if you had to do that for the rest of your life,
Yes,
and or urinary incontinence is one of the most common things that lands people in senior living facilities. So if you
it
get to a
does.
point that you can't take care of it yourself or your family members can't help you take care of it, now that puts that you're not able to live independently as much anymore. So the long-term cost of just living with bladder leakage can way outweigh a short-term cost to help it to get over it. So
Absolutely. Well said. And I'm so glad you brought that up. So, if I was not in the St. Louis area and I was going to be looking for a specialist,
yeah.
what would be some of the questions I should be asking?
So you want to, and it's always good to start up with your local physical therapist that you're familiar with.
Yes.
Or if you don't have one that you're familiar with, you know, this is a good time to go to Google and just type in pelvic physical therapy near me
Okay.
and see what comes up. But if you're calling up a physical therapy practice, you want to ask them, do they have a dedicated pelvic physical therapist?
Okay.
Pelvic physical therapy in the last 5 to 10 years has become a little bit more popular and a little bit more of a buzzword.
Okay.
And so there's many people who dabble in pelvic physical therapy who like, yeah, I do it. And maybe one or two of their patients a week are a pelvic health person, but the rest of them are knees and shoulders and that. And it's like, nope, you're dabbling in this. Like you want
Yes.
someone who the majority of their caseload are pelvic health issues.
All
So
right.
that's why you want to ask, do you have a dedicated pelvic physical therapist? And what percentage of their caseload are pelvic cases?
All
Okay,
right.
that can let you know, okay, this person is doing this a lot. Like,
Yes.
so, just like you don't want the heart surgeon who just graduated medical school and you're his first heart surgery, it's like, okay, like, do I want the person who just started doing this or so?
Yes.
So
Yes.
that's something to ask for. There are some certifications that they're not required in our profession. So it's required to have your license in physical therapy. But if
Yes.
you're in the pelvic world, you can voluntarily go on and get some different certifications to show your expertise. So you could look for someone who has the initials WCS or PRPC after
Okay.
their name.
All right.
Um, those are both two different types of pelvic certifications. So that at least shows you this person took the time and effort to go on and take a test and show their proficiency and that. So that can help a little bit too.
Okay.
Okay. There's some great directory websites out there, pelvicglobal.com.
Okay. All
You
right.
can put in your zip code and be able to look up for providers near you. What's another one? Our national organization, so it's APTA.org is our American Physical Therapy Association.
Yes.
If you go to the pelvic health section,
All right.
they too have a PT locator, and Linda, I can send you these websites so you
Perfect.
can post it in the show notes. But these are different directories that people can go to put in their zip code. And what I tell people is, if you put in your zip code and you put like, I'm willing to drive 10 miles and you don't find someone, put in 20 miles, put in 50,
Yes.
keep going out and out until you find one, even if they're like 200 miles away. Like, I know that sounds crazy, but call that clinic and then ask them like, hey, I live 2 hours away from you.
Yes.
Like, do you know I live here? Do you know anyone in this town? Because the directories aren't foolproof. It doesn't have everyone in it. And a lot of times in the pelvic health world, we know where someone else is located and we can be like, oh, yeah, Sally's actually in the town over from you. Like, go see her. So,
That's very helpful information. So I appreciate you sharing that with
yeah.
us because that's going to help people get the care that they need. And I guess from my own perspective, I would say, do you have a private treating room?
Yeah. No.
That might be
Yeah,
another thing.
you were supposed to remind me, Linda. No, I forgot too. So, yes, so we have had patients who have come to us after doing pelvic physical therapy somewhere else. And we always ask, like, okay, what worked? What didn't? What did you like? What didn't you like? And one of the common reasons that we see people transfer to us is, again, kind of our private calm treatment center, because we've had several people who they're like, yeah, I was out in the gym area and they just pulled a curtain around our table. And I was like,
Hmm.
oh yeah, no, that's not comfortable at all. Like I wouldn't want to like just on the other side of the curtain is, someone
Hmm.
else doing his knee exercises and you're trying to talk about the fact that your bladder's leaking and you're having
Yeah.
issues. And I was
Yeah.
like, okay, no. Yeah. So asking if they do have a private treatment room would be another good one.
Wonderful. Well, Brooke, this has been so helpful. I really appreciate it. And I know our listeners can hear the passion in your voice about what it is that you do and how great that you can use your degreed area of expertise in a specialty way that is going to impact people's ability to live their life to the full. So I want to thank you personally for all you do for your patients. But I told you that I always end my podcast with a caregiver tip. So can you share your caregiver tip for my listeners?
Yeah, wonderful. So I was thinking of the caregivers in terms of all of probably the extra lifting that they have to do, whether it's all of the laundry, all the groceries, maybe they're even helping to lift their loved one and that. And so when you want to think about lifting in order to protect your core and pelvic floor so you don't potentially end up with issues, I want you to think about what we call exhale with exertion. So as you are doing the lift, you want to think about blowing out. This helps to release pressure out the mouth so that we're not putting pressure down through the pelvic floor. And
Okay.
that's so just thinking about as you lift, exhale with exertion.
That's opposite of what I would do, Brooke.
Yeah, a lot of people suck in and hold their breath to do
I
the heavy
do.
lift. Yep.
So,
And it,
so
like
that's opposite.
here and there doing it, it's not a bad thing. It's when we keep doing it over and over and over again, eventually the system wears down. Eventually the system's like, I can't handle this pressure anymore. And that's,
Yes.
where it is more common that we have the pelvic health issues as we're older, but that's also because we've had years of potentially doing some bad habits for our pelvic floor that we didn't know about.
Yes, and that's where education is so important, but also for the caregiver who is starting to notice and starting to come to the realization that things are changing with the person that they're caring for. Please think about what we've talked about today because this is a life changer for people. And I also heard you say a key word that I want to bring back, and that is short term.
Mhm.
Therapy doesn't go on forever. You are evaluated, you're educated, you are shown the exercises that you need to do to change what you're experiencing, and then you are discharged
Mhm.
from therapy. You can always go back for a tune-up,
Yep.
you know, and the onus is on you. Now you have to decide, am I going to keep up with my exercises? Otherwise you pay for that privilege of going back and seeing Brooke more often and
Well,
her team.
we always try. So I completely feel you there on like the trouble of people trying to keep up with their exercises. So when people are nearing graduation, and typically depending on what's going on with the person, we're working with them maybe for 2 to 3 months on things. But as we're nearing graduation, what we really like to try and do is, figure out what you already like and enjoy doing,
Okay.
exercise wise, fitness wise, and fitting your kind of what we call your pelvic health maintenance program into that
Okay.
versus, okay, I got to find 5 to 10 minutes every day to do my pelvic exercises and keep up with that. It's like some people do that because they're kind of couch potatoes, and they don't they don't necessarily have a fitness routine that they're going back to. But if it's, someone who's like, well, I do yoga twice a week, or I do Pilates twice a week, or I weight lift, or like, it's like, okay, cool. This is what I want you to think about during those workouts to make sure you're getting kind of a 2-for-1. You're making sure you're working your pelvic floor the right way. And that should be enough to maintain it. But there are people who, whether they know themselves and they're not necessarily going to keep up with things. We have several patients who do tune-up appointments like monthly or every couple of months to check back in. And then we have others who do kind of, I call it like the dental plan. We see our dentist twice a year. They come see us like twice a year. They're like, I just want to make sure that I'm still doing fine. Like,
Yeah.
I don't want to have another issue come
Great.
up. So I'm going to proactively come back and make sure that everything's still working well.
Yes.
We love that. Keep doing that. That's awesome that you're being proactive. So
Yes, and that proactivity. I mean, just you said it, so I'm just going to repeat it because these are the things that I see on my side of working with seniors over the years is that your incontinence doesn't only affect your daily life, it affects your relationships with others, and it will begin to affect your health. And then it will affect your quality of life and where you would like to spend your senior years. So all I want you to hear, listeners, is that there is help out there. And if you're in the St. Louis area, I want to encourage you to find Brooke and her team at Legacy Therapy, STL. I'm going to have all the links in the show notes. And Brooke, thank you again for coming on and talking to me today. I feel like it was a huge blessing to meet you at that vendor event, and that you had sent me information that was helpful, and that you were there. You are there. You and your team are making such a difference. So thank you so much.
Thank you.
Carry on, do well. And I wish you and your team a very happy holiday.
Thank you as well, Linda. I appreciate it.
Thank you for joining me today. Please remember that this podcast is intended as education and not advice. Don't forget to share this podcast with family, friends, or colleagues who want to learn how to age in place, but also share this with those who find themselves in crisis mode. Please go to my website, seniorsupportstrategies.com, for more information. When you subscribe to Aging in Place Strategies and Answers, you gain access to premium content and professional tips on creating your own aging in place roadmap. As always, I value the time you spend with me.